Today, Jennifer Weber explores government policies as power in determining the status of children's health and adequately addressing their nutritional needs. She suggests changes to our policies to continue to improve children's health at all levels of government and analyzes existing program initiatives targeting these areas. Continue listening to learn more about how you can get involved in childhood health and nutritional advocacy efforts.
Podcasting from Dallas, Texas, I am Shireen, and this is the Yumlish Podcast. Yumlish is working to empower you to take charge of your health through diet and exercise and reduce the risk of chronic conditions like type 2 diabetes and heart disease. We hope to share a unique perspective and a culturally relevant approach to managing these chronic conditions with you each week.
Jennifer Weber is an advocate for children's health and well-being with experience building effective strategies and partnerships. She translates science into understandable and actionable messages for organizations, policymakers, and communities. Welcome, Jennifer.
Thank you. It's a pleasure to be here.
Pleasure to have you on. So, Jennifer, tell us what inspired you to pursue a career in children's health?
My background is in nutrition and dietetics. When I was first practicing, I was working with adults with chronic diseases, and it just really struck me how difficult it was to help those adults pursue a healthy life at adulthood when they didn't have those opportunities when they were children. And it just really struck me that we needed to create healthier environments, support healthier environments for children. And that's what led me down this path.
Interesting. So tell us, what is the current status of children's health and their nutritional needs in the United States? And in particular, what areas need improvement?
Well, this is certainly very challenging right now. COVID has really negatively impacted children's health, accentuated the challenges that we had before. Most obviously in food insecurity, we've seen increases in food insecurity over the past 18 months, and almost 1 in 5 children are living in food insecure households right now. So that is certainly a great concern. In addition to that, if we look at nutrition specifically, children are not consuming enough fruits and vegetables. Adults are not also consuming enough fruits and vegetables, but certainly a concern for children. And then they're consuming too many sugary and sweet foods, so that proportion of the food that children are consuming are of concern. And of course, I need to note that we also want to make sure kids are being physically active, and only about 1 in 4 children are getting the amount of physical activity, which is 60 minutes of physical activity a day. So those are some of the overarching challenges that we're seeing right now.
So how do policies factor in at the local, state, federal levels to really maintain children's health initiatives and also perpetuate sort of poor health?
It is very true that policy at all 3 of those levels, federal, state, local, and then even some smaller ones like school level, impact children's health. And so if we look at what that looks like, many of the programs that support children's health are structured and funded at the national level. So that might be where the funding comes from, where the overarching guidelines come from, but then that funnels to the state and state governments often. And so then they may put additional guidelines or parameters around that. They look at how the program's going to actually be implemented. And then when you look at who actually is implementing that program, who's the direct line to implementing these policies or programs to the kids, that happens at the local level. So we very often see federal, state, local level tiering of initiatives for children. And you see that with federal food programs. So the SNAP program, Supplemental Nutrition Assistance Program, the WIC program, which is Supplemental Nutrition Program for Women, Infant, Children, school meals, all of those programs, the structure is developed at the federal level, but then implementation flows down to the local level.
Interesting. Can you walk us through an example of something like this where there was a federal policy around children's health and how it trickled down?
Yeah, I mean, one example that is a good one, and I'll talk about how it operates and then also how it was impacted during COVID, is school meals. So the National School Lunch Program, there's also school breakfast program. That is a federal program. It is funded, at the federal level. It is a program that all students have access to. And so the structure of the program, the overall nutrition guidelines of the program, eligibility, cost of the program, that's determined at the federal level. Some of those designations are made in law. Congress, determines them. Some of it is designated to the federal agency that has oversight, which is the U.S. Department of Agriculture. So there's those the federal structure of the program. But then those funds go to the state. So each state, it might be, in most states, it's the Department of Education. They have the oversight for that program. And they may say, okay, here's the standards that the federal government put in place. We have to follow those, but they might put additional guidelines in place. Or they might require additional training for the people that work in that program. And they are responsible for oversight of the school districts. Then at the local level, that local school district is one that's determining, what actual foods are being served. The federal government is saying you have to serve, broccoli. I mean, those decisions are made at the local level. The paperwork and enrollment, that's all happening at the local level. Advocating for the program, trying to get kids to participate. Those are things that all happen at the local level. And so I think oftentimes people hear policy and they think it is something that happens, way over somewhere in Washington, D.C. But these issues of how the programs are directly implemented happen at the local level. And especially in this issue of school foods, we've seen lots of advocacy bubble up from the local level around wanting to have culturally appropriate foods, really advocating for local foods or more fresh foods. And so there's a lot to play there. And I think this program is particularly interested when we look at the impact of COVID and the schools shutting down. So we know that, many kids receive one, if not two meals at school, and then that whole system, right, that went away. The amazing thing was how quickly the school nutrition directors, school districts, state, federal government really went into action to try and still provide food for those kids in a setting where school was not in place. And that, is not easy from a logistic factor, but there were also laws and regulations that had to be waived. And so a bunch of waivers were put in place. Some were around nutrition standards to allow some flexibility so that schools could, get food and serve it. Also around eligibility, a lot of places went to providing free meals for all. So instead of having a tiered system of, full price, reduced price, and no cost meals for students, which is the standard, they put in, free meals for all, which really helps to promote and get students in. But it also really helped the schools not have to deal with, lots of paperwork and challenging situations. And so, I think all of these, you have to have these strong policies and regulations in place, but it also showed how, in these really difficult, trying times, there was flexibility put in place. And we've learned a lot from this. And a lot of places now are advocating for free meals to continue, especially as we really saw how important school meals were for the nutrition status of children over the past year to year and a half.
What policy changes do you think should be made at each of these levels, the local, state, federal level, to really improve children's health and better meet their nutritional needs?
Yeah, I think there's a couple overarching things. One is, it's so important that kids are surrounded by these healthy environments. We talk about, or you hear people talk about, we need to teach children to be healthy. And I agree with that, but there's only so much we can expect children to do when they're surrounded in these environments that aren't healthy. And especially younger children, they don't have choices. Adults are making the choices for them. And so I really think, it is on us as the adults to have policies that support healthy environments. for kids. And that can look lots of different ways. That could be, making sure that that all the choices in the school are healthy food choices, that we're exposing children to a variety of foods at young ages in childcare centers, that we are being really careful about what foods are being marketed to children on the different devices and activities that they're in. The other piece I think is so important is thinking about equity and access in the policies that we're passing, and that the voices and perspectives and beliefs of those that will be impacted by the policies are included. I think there's been a lot more movement in this, but, there still is this thought of, well, we know that children should be eating healthy. So here's the 3 things we're going to say. We're going to teach them nutrition, something. But that community, that might not be their biggest concern. So that voice of the community, I think, is so important. And I'll just say, when I talk about the voice of the community, that includes kids and youth. We really, they're so creative in their solutions. In a lot of my work with children and youth, what has struck me is that when we have to work toward policy change, the people we're convincing are the adults, not the kids. They're on board. They have creative ideas. They're super open. They want to be healthy. They want their families to be healthy. And so making sure that youth voice is included is really important. So I think that, those issues of equity, of thinking about it being the environment, not just the individual, are really important pieces across the board, no matter what the policy is that you're looking at.
And so walk us through some examples of what this looks like in a community trying to combat chronic illness and risk factors for children.
Yeah, so a couple examples just from the community where I live in, and one is looking at federal nutrition programs. So SNAP, that's the Supplemental Nutrition Assistance Program that provides electronic benefit for families to purchase foods. So it's a federal program, but again, that enrollment happens at the local level. And so, we have an organization in our community working closely with the health department to do outreach about the program, make sure people know it exists, goes to, schools or different community events, faith organizations, and helps people sign up and enroll in the program. We can have these federal programs initiatives, but if you don't have people participating in them, they're sort of, we're losing the opportunity, that benefit. Another piece of that is many local communities have done what they call bonus bucks or double up bucks with SNAP, where a local, could be a nonprofit business, puts in extra funds. So if people use that benefit at a farmer's market to get fruits and vegetables, they get double the dollars. So it's an incentive, right? We are trying to give people more buying power around foods that we know are short in children's diets. And support that, and then also support the local economy. So, it gets the business community engaged. I think those things where you can, look at what others in the community will see as benefit is really important. Other things that happen, at the local level, definitely we've seen a lot of work around promoting walking to school. Again, some of these are school focused because kids are going back to school this year, right? We're really excited to have them back in that space. But the concept of, we know that school attendance, engagement in school is really important. We also know that it can be a challenge for some kids to get to school. And so there's been lots of work on safe route to school, walking school buses, where you really look at, can we have a safe environment for our kids to walk to school? And again, this is one of those, I think it's a great example of a double impact, because schools want kids to be in the seats. And so if you put together a walking school bus where someone's coming along and like picking up kids walking, or really focus on safe routes to schools, kids are getting physically active and they're getting into school. And so often when we look at nutrition and health, it's, looking at what's the double win, the triple win is really important. No one's against nutrition per se, but it's really hard often to get nutrition to be high in the priority list of all the other challenges and issues that policymakers are looking at.
And of course, with all of my biases, with what we do at Yumlish, I wish nutrition got more time of day because it's so incredibly important. You mentioned a couple of minutes ago about how parents are making those food decisions at home. They're making those food choices. Again, just going back to policy and even community-based initiatives, what is being done outside of the school setting, looking at more of the family holistically?
Yeah, so in a lot of those cases, again, there's really good initiatives to work on educating children and their parents around, what do healthy meals look like. But that's assuming that they have the resources and the capacity and the skills, right, to be able to do that. So any issues, again, that are looking at food access, really, again, participation in programs, federal programs is really important. There's also work happening around what's called healthy food financing initiatives. So looking at communities, we look at, what is food availability in communities, and then what resources are there that we could work with to improve food access. So healthy food financing works with corner stores or bodegas, places in a community that maybe have shelf-stable items, but perhaps don't have the healthiest items available. And why is that, and what do they need? And so many times those are, they don't have refrigeration, or they don't have a supplier, or they don't have perhaps a consistent customer base for those food items. And that provides additional foods to help them. That, is a really important piece. So, I think that's a big one. Many of the federal feeding programs, that work outside of schools really target mothers and children and getting healthy foods into their hands. And those pieces are all important. And then, I think as we look at, again, the environment that our kids are in and the images that they see and the advertising and marketing that they're exposed to, there's been quite a long time where we've been working around trying to limit marketing of unhealthy foods and beverages to kids. Some communities have taken that on and they've looked at it different ways. Some communities have really worked on altering the kids' meals at quick serve fast food restaurants so that, they take soda's not the default beverage, it's milk or water. And those changes make a big difference. People do tend to order the default thing on a menu. So if kids are going through and ordering a kid's meal and it's milk or water instead of a sugary soda, that makes a big difference. Other places have really worked on trying to get those incentives out of kids' meals and not having the toys with them. And those are just all things to try and change some of the norms maybe that we've put into place, or things that, if a parent's going for a quick meal and we just, a couple things are subbed out in that meal, it makes it healthier. That makes it a whole lot easier for the parent. So, easier, less stressful, less debate with the child are all things that can make a big difference for parents. And then putting more purchasing power in their hands, for parents who are struggling and have limited resources. Any of the programs that can give them more purchasing power makes a difference.
Makes sense. Let's talk about the work that needs to be done still. So what advocacy efforts are being done to address these needs in childhood health and nutrition? And then how can folks get involved?
Yeah, well, so with policies and programs, those are always under review. Funding is under review every year. So there has to be a consistent drumbeat. So there are, advocacy groups at the national level that every year we are, advocating for funds for nutrition programs, the prevention programs that Centers for Disease Control operate that fund, to the states for healthy campaigns, for healthy water, things like that. Those are things that we are advocating for every year. And then there are certain 5-year cycles where some of these major programs get reviewed. So those are important. But, these conversations are happening all the time at the local level as well. And, for people that are interested in being involved locally, the first thing I would say is know that your voice is important. Sometimes people say, well, I'm not an expert in this, I don't want to say the wrong thing, or what if they ask something and I don't know the answer? You you have a voice and you are important. So, that's the first thing to think about. And then what are you passionate about? Are you passionate about the food that's served at your faith organization that you go to? Is there a park down the street that you are concerned about? You can just start there and, talk to someone at that organization or look at your county parks and rec. If you want something a little more structured, every local district has to have a school health policy council or school health advisory board that the public sits on. Many communities have a food policy council that, they have members, and they might need volunteers, but they also are there to get public input. So, what is it you're passionate about? Is it little kids? Is it school age kids? Do you want to do youth advocacy and get youth voice out there? We need every voice in this space. And so, it's not bad to start locally and see. If that's not for you, or what you're like is I want to write a letter or send an email, on something at the federal level, there are many groups that work in this space. Food Research and Action Center is a really strong anti-hunger group. There's a group called Moms Rising that takes voices of lots of moms, many groups that are tied to different racial, ethnic groups. And many of them have what we call action alerts, where you can go in and, put in your zip code, and it helps give you some talking points to weigh in at the federal level. So there's so many ways to get involved. I'm happy to guide people. I work with organizations to help set up talking points and guidance and training for advocates to get comfortable with sharing their knowledge and expertise, because really that's what we're doing, is connecting people to the policymakers so they can share your input, and your voice always matters, and you have experience that they need to hear from. And then I'll just say, we can't assume that someone else is speaking for us. I mentioned this earlier. We don't generally have people who say they're against healthy children, right? Everyone wants to have healthy children, but when we are talking about, investing money in these initiatives or wanting some new policy campaign or advocacy movement, we are competing for space and attention. And so we need more voices and new voices in that conversation.
That's so interesting. So even within our own individual sphere, there is a lot that we can do. It's just we have to understand exactly what to do, either on the local or federal level. So with that, Jennifer, we're toward the end of the episode. How can our listeners connect with you and learn more about your work?
Yeah, thank you. So I do have a website, which is webermorepartners.com. I'm also on Twitter at jweberva is one, and then a company is at Webermore LLC. So those are both ways to connect with me. And if you go to the website, you can connect with me by email or message me. I'm super happy to talk with advocates. I should just say as a wrap up, I started out, I'm a registered dietitian, and I worked in a clinical setting. I would have never thought I would be, doing policy and advocacy work. And I went from that, to being a registered lobbyist and doing policy and advocacy across many levels. So it is something that we all can do. And I'm happy to, help individuals or organizations work down that path.
Love it. Thank you so much, Jennifer, for your time. It was an absolute pleasure having you on.
Thank you. It was my pleasure to be here.
Lovely. And for our listeners out there, head over to our social media on Facebook and let us know what's one policy change you want to see in your community related to children's health and nutrition. You can find us at Yumlish_ on Facebook. Head over there and tell us what is that one policy change you want to see in your community related to children's health and nutrition. We will see you there after the episode. Jennifer, thank you again.
Thank you.
Thank you for listening to the Yumlish podcast. Make sure to follow us on social media at Yumlish_ on Instagram and Twitter, and at Yumlish on Facebook and LinkedIn for tips about managing your diabetes and other chronic conditions, and to chat and connect with us about your journey and perspective. You can also visit our website, yumlish.com, for more recipes, advice, and to get involved with all of the exciting opportunities Yumlish has to offer. If you liked this week's show, make sure to subscribe so you can hear more from us every time we post. Thank you again, and we'll see you next time. Remember, your health always comes first. Stay well.